Hi, everybody.
Hello, we're here, True Potential, a regular work day, just taking our lunch break to shoot a little quick video for you guys in regards to intravenous therapies, because we get lots of questions.
So in case you don't know who we are, I'm Dr. Fleury, this is Dr. Pihowich, and we are your IV extraordinaires here at True Potential. So we wanted to just talk a little bit with you today about why IVs, because it's that time of the year where we're starting to see the increased need for generalized support.
Yeah, usually people start feeling kind of trashy when the weather changes, when the season changes, and when we're getting less sunlight. So taking care of yourselves now is definitely a good time of year to focus on it. And where IVs come in handy, and just so we're clear, we're doing intravenous nutrition, basically. It's vitamin C, it's B vitamins, it's calcium, magnesium, zinc, selenium, and then there's more specialized IVs like glutathione and NAD. But generally, what I mentioned, all those nutrients in the first place, is something called a Myers cocktail. That's kind of like a do-it-all IV. Mm-hmm. And people just generally feel good when they get them. And where we're using them is mostly where people are just feeling really, really, really low. So we kind of talked about this a little bit beforehand, but mm-hmm. where someone's acutely sick with, let's say, Crohn's colitis, mm-hmm. when someone maybe even has an MS flare, or when someone's just under a lot of stress and their system isn't doing a good job of absorbing their oral vitamins, it's just a nice foothold to get them feeling better to then maybe absorb their orals better or knock them out of a flare. So that's kind of how we're using them in clinic.
And one of the signs or one of the indicators that might alert me to refer somebody in for an IV is if they are eating pretty well, taking their supplements pretty faithfully, and still not feeling at the top of their game. So I always say IVs are diagnostic and therapeutic in the sense that you're getting benefit from doing an IV. You're bypassing the guts needing to absorb those nutrients. But it's also in many ways diagnostic in the sense that it gives us a sense of how do you feel when we take those same nutrients that you're taking as a supplement, and now we're bypassing your need to absorb them, and we're going straight into the system.
Yeah.
So, and if you start to feel better by doing that, we go, aha, so maybe your gut's not absorbing as well as we think.
Yeah, it's a nice way to kind of just get a base point line for how you do with good nutrition. Is one way to think about it. Yeah. So if you, like you said, if you do really well from an IV, but you're not getting the same effect from your supplements, well, let's figure out why.
Mm-hmm.
Yep.
Absolutely. So we have a lot to talk about. We do some really interesting IVs here. So Dr. P talked about the Myers cocktail, which is kind of our intro IV in the sense that we just want to see how do you feel. And, sometimes what I also want to point out is that you don't often feel better from one. Sometimes it takes a couple IVs because if you're pretty deficient or pretty depleted, it can take a while for your system to really benefit from it.
It depends how low you are.
Exactly.
I usually find the first one, if someone's really low, they feel actually more tired the day after, like their body's kind of like knocked into this recovery state. But then the second one, they feel more of a boost.
That's a really good way of putting it. And we actually see that from intramuscular injections. A B12 shot can make you feel, even more tired when you initially get it because, like you say, it knocks you into recovery. So that's a good thing to remember. So we will be in future videos talking about the glutathione and the NAD that we do here. So stay tuned. And if you've ever wondered if you are a good candidate to do an IV, or you've been curious about it, or just haven't taken that next step to come in for an IV, call the front desk and go ahead and book yourself an appointment. You don't need a referral to come in for an IV. And we'd be happy to introduce you to one of our great services here. Mm-hmm. So until next time.
Thanks, guys.